Hi, my name is Christopher Graffeo. I'm a neurosurgeon specializing in adult cerebrovascular diseases and skull-based tumors. It's been a privilege to train in three extraordinary and diverse environments. My formal medical education began at NYU School of Medicine, home to Bellevue, one of America's oldest and biggest public hospitals, and an institution that invests trainees with a true appreciation for medicine as both a calling and a service. After finishing medical school, I went on to complete my neurosurgery residency at Mayo Clinic in Rochester, Minnesota, where I spent 7 years studying with some of the most influential leaders in our field, including fellowship-level training in radiosurgery with Bruce Pollock and skull-based neuro-oncology with Dr. Mike Link. Finally, I completed a fellowship in open cerebrovascular and skull-based with Dr. Michael Lawton, the chair and CEO at the Barrow Neurologic Institute in Phoenix, Arizona, arguably the busiest and most innovative center in the whole world of neurosurgery. Each of these experiences taught me really unique and invaluable lessons that have shaped my approach in caring for neurosurgical patients, and I think really empowered me to build a practice that delivers world-class complex cranial care right here in Oklahoma City. I was drawn to OU Health by the opportunity to join a growing team where I would be able to make a meaningful impact on the lives of as many patients and families as possible. In my view, the people of Oklahoma deserve the same level of excellence and professionalism that is available at storied institutions like Mayo and Barrow, and it's genuinely an honor for me to join a team that has prioritized that goal above everything else we do. My personal area of expertise is complex cranial surgery, which is a subspecialty that really combines skull-based tumors and cerebrovascular diseases in adult and pediatric patients. My training includes advanced techniques for both open and endoscopic skull-based operations, as well as the full spectrum of open cerebrovascular treatments, which might include aneurysm clipping, AVM or arteriovenous malformation resection, brainstem cavernoma removal, and cerebrovascular bypass, which is its whole own world of neurosurgery. Finally, I also specialize in stereotactic radiosurgery, known colloquially as Gamma Knife, which is a high-precision, non-invasive tool for delivering radiation treatments with very high precision to challenging or critically located diseases. OU Health Neurosurgery has a very unique approach to team building that is empowering us to deliver one of the most successful departments in our specialty at the local, regional, and national levels. We have recruited talented neurosurgeons from all over the country, including homegrown stars and national leaders, whose collective backgrounds represent essentially all of the major centers and training programs in neurosurgery. Even more importantly, every member of our team believes in the utmost importance of collaborating to deliver the best possible outcomes for all of our patients. In that way, we have been able to combine the strengths drawn from many centers to build a true multidisciplinary neurosurgical mecca here in Oklahoma City. A day in my life starts early. Most mornings I'm up by 5 and I always try to exercise first thing, typically with a bike ride. From there I shower up and head to the hospital where I make rounds on my patients who are typically recovering from surgery. The next stop is either the operating room, where we do between 1 and 4 cases depending on their complexity, or to the office where we'll visit with 20 patients or more on a typical clinic day. Whenever possible, I try to get home for dinner with my wife and my 2 boys, but life in neurosurgery can be unpredictable, and it isn't unusual for me to operate or take call well into the evening. Some days are focused on research or teaching our residents and our medical students, but it's pretty much unheard of to have a day without at least some time dedicated to the most important aspect of my job, which is, of course, the care of neurosurgical patients.